Rotator cuff injuries are extremely common, and as orthopedic surgeons, we see those all the time. And I think we're probably treating them more frequently because we're diagnosing them better, MRIs are better, but more importantly, patients want to stay active longer. So it used to be that rotator cuff tears are typically kind of age-related injuries, and as you get older, there's a very high percentage of patients who have rotator cuff tears. And you used to say live with it. You know, if you're just watching Netflix or playing the piano, you could probably get away with having a rotator cuff tear. But as older patients want to stay active playing tennis, golf, pickleball, all these sports, not having a functioning rotator cuff becomes much more of a problem. We've really innovated with regards to rotator cuff repairs, and it has to do, I think, with how we're able to perform the surgery. We used to use big incisions. It'd be a long recovery process because of that. Now we've got, doing it arthroscopically. Our cameras, our visualization is improved. The anchors that we're using are stronger. The sutures are stronger. And now we even have sort of anchors that allow the surgeons to not have to tie knots to make it stronger and even a quicker procedure. And I think the less time you're spending in the OR, the less sort of traumatic it is to the patient, the quicker their recovery is going to be. So I think these advancements have really helped both the surgeons and the patients.